Hello, good morning. This is Dr. Talari. Today, I would like to tell you a few tips on how you approach a clinical examination when you don't have any clues in the history. I'll tell an example. Suppose if you have a case which is 70-year-old female or male came to you complaining of tiredness all the time. So you took thorough history, like you took the history of presenting complaint, you ruled out the other causes, like you ruled out that she is not on any medicines causing tiredness, or she's not on alcohol, or she's not having any infections, no chronic rheumatological conditions, nil cardiac, nil respiratory problems, nil endocrine problems like tiredness can be because of diabetes, she's not having any CNS problems, she's not having problems with sleep, and she's not having any history of cancers. So you very rarely will come across such a case where you took the entire history, like you might take 3 or 4 minutes of very good history taking, but still you would have forgot something. I know that few people will ask things in social history, but not every time every candidate will think of social history. But if you are in such a situation where you have problem, you can ask this question, like how are things at home? This is a very important question while you ask the social history. See, if she has some problems like an elderly abuse, or if she is having problems at home, or if she has a marriage breakdown, or if she had a pet which has died a few days ago, or anything, or if she has become a bankrupt, anything can cause depression. So I think this question, like how are things at home, will help you if you don't have any clues. Use this one only when you think you have taken the entire history, and if you think you don't have anything in the clue. And the second thing, this is one thing which I learned while I was preparing for my exam. There is one more question which will help you. This question actually helped me in my exam, where I took entire history and I didn't have any clue. Then I had these 3 questions in my mind. I should ask this, and the third one. So I tried the first one. She said, I'm very happy, doctor. I don't have any problems, and my husband is very good gentleman. He's looking after me, blah blah blah, all these things. Then I asked the second question, is there anything that I forgot to ask you which is important? So this one is a very important question. Like then the patient said, doctor, I had actually, I'm not telling the exam scenario, I'm just telling an example because of breach of copyright and things like that. So I'm giving an example. The patient might say, oh doctor, I had a marriage breakdown. That is a clue for depression. Or the patient might say, doctor, I had a surgery done 1 week ago and everything started after I had this surgery. So it's very important that you ask this question when you don't have any clue. And the third one, which might not help much, is did you have this complaint before? Or I know that you will ask this in past history, but sometimes this helped me while I was doing role plays with my friend. If he says yes, so you ask the patient directly, what was the diagnosis, or what did the doctors tell that the condition was? In that case, actually the patient gave the clue that he had gallstones. So I came to a diagnosis, it was actually tummy pain, and I came to a diagnosis that it can be most likely gallstone disease. So I think these 3 questions will help you. Don't try to use them in all the stations, but use them if you need them, okay? And if you have some questions which will help in a difficult situation, please comment me and I will learn something from that. And if you have any doubts in this one, please leave a comment and I will be addressing your comments. And if you have not yet subscribed, please subscribe to my channel, and you can watch all the videos, you can get my notes, and the other thing is you will be notified whenever I add a free whenever I add a video to my channel daily. And the other thing is, these are free. You need not pay anything. This is a free subscription. Okay, see you later.